Good day everyone, this is Mary Rose Garcia, a second-year nursing student from Section Wiedenbach. So for today's video, I'm going to perform an eye installation demonstration. Eye installation is the administration of the medication to the eye. First, you have to assess the patient for any allergies. Check expiration date before administering medication. Assess the appropriateness of the drug for the patient. Review assessment and laboratory data that may influence drug administration. Verify patient's name, dose, route, and time of administration. Assess the affected eye for any drainage, erythema, or swelling. Lastly is to assess the patient's knowledge of the medication. Is to directly apply the medication to the patient's eye, to provide means for eye evaluation, and to obtain desired therapeutic effect. Normal saline solution, tissue, washcloth, cotton balls, or gauze band. The gloves, which is optional, the medication. Step 1. Gather equipment. Check medication order against the physician's original order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is a legal record of medication orders for each agency. Step 2. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Step 3. Perform hand hygiene. This step is to prevent the spread of microorganisms. Step 4. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. This is for organization that facilitates error-free administration and saves time. Step 5. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medication. Step 6. Identify the patient by checking the name and identification band or ask the patient to state his or her name. This is to ensure that the right patient receives the medication and helps prevent errors. Step 7. Explain procedure to the patient. This is to gain patient's cooperation and to allay anxiety. Step number 8. Offer tissue to the patient. Solution and tears may spill from the eye during the procedure. Step number 9. Cleanse the eyelids and eyelashes of any drainage with a washcloth, cotton balls, or gauze moistened with a normal saline solution. Use each area of the cleaning surface once, moving from the inner toward the outer canthus. This step is to prevent the carrying debris to the lacrimal ducts. Step number 10. Ask the patient to tilt his or her head back slightly. The head may be turned slightly to the affected side to prevent solution or tears from flowing toward the opposite eye. Tilting patient's head back slightly makes it easier to reach the conjunctival sac. This should be avoided if the patient has a cervical spine injury. Step number 11. Remove cup from medication bottle, being careful not to touch the inner side of the cup. This step is to ensure that the inner side of the cup may not be contaminate the bottle of medication. Step number 12. Invert the monodrip that is commonly used to instill eye drops. Have the patient look up and focus on something in the ceiling. By having the patient look up, the procedure is less traumatic and keeps the eye still. Step number 13. Place thumb or 2 fingers near margin of lower eyelid immediately below eyelashes and exert pressure downward over bony prominence of cheek. Lower conjunctival sac is exposed as lower lid is pulled down. The eye drop should be placed in the conjunctival sac, not directly in the eyeball. Step number 14. Hold Doppler close to eye but avoid touching eyelashes or eyelids. Squeeze container and allow prescribed number of drops to fall in lower conjunctival sac. Touching the eye, eyelids or lashes can contaminate the medication in the bottle, startle the patient, cause blinking or injure the eye. Do not allow medication to fall onto cornea. This may injure cornea or cause the patient to have an unpleasant sensation. Step number 15. Release lower lid after eye drops are instilled. Ask patient to close eyes gently. This allows the medication to be distributed over the entire eye. Step number 16. Instruct the patient not to rub the affected eye to prevent injury and irritation to the eye. Step number 17. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step number 18. Assist patient to comfortable position. This ensures patient comfort. Patient cooperates with the installation of